This
of this moment.
conference will now be recorded.
There we go. It will be posted later today on the Chamber's website at www.nacogdoches.org. We've also invited members of the media, and I see we have several that are already on the call to join us for the call as well. Do want to let you folks know that, again, the Chamber has a wealth of information on the Chamber's website at www.nacogdoches.org. We hope that you'll take time to tune in and review that information at some point. We update that almost on a daily basis at this point. So again, we'll begin with our presenters today, and we'll use the same format as we've used in previous weeks, where I will invite them to say hello to us and share any opening statements, and then I'll present a series of questions to our presenters and ask them to respond. And I'll open the forum for questions at the conclusion. I'm pleased to welcome this morning one of America's superstar in association management, Stephen Anderson, President and CEO of the National Association of Chain Drugstores. Steve is a former CEO of the National Restaurant Association, the American Frozen Food Institute. Many years ago, we were both colleagues with the U.S. Chamber's Institute for Organizational Management program, and Steve was a past national chair, and I've got to tell you that he truly is viewed by those of us in the nonprofit world as one of the truly outstanding and extraordinary CEOs in the country, and we're just delighted to have Steve join us this morning at this very important time in the pandemic. He's often requested as a guest on national news programs, including CNN and Fox News and other programs. So he may look familiar to many of you folks. Steve, welcome to Nacogdoches. We're delighted to have you here. I'll start by just asking if you have any general comments, and then we can launch into the questions.
Wayne, great to see you again. We've known each other for decades, and I was delighted that when you contacted me after I did something with the U.S. Chamber that was seen by local chambers and state chambers and metro chambers. And I have a great love in my heart for local chambers of commerce, having grown up in Belvedere, Illinois, which was a community of about 15,000. And for purposes of this discussion, as we're going to get into COVID and possibly the flu, which is very important for people to get their flu shots, we're really building a grassroots network in terms of local chambers, and in order to get the word out about the importance to get both the COVID and the flu shot, because we cannot fully open our economy in this country, and we fully can't open businesses in your community and elsewhere until we get this virus under control. And I think I'm a firm believer of association work, as you know. I think I've been called a radical associationist because I think associations can do a lot, and I'll throw other not-for-profits in there like chambers. But fighting this COVID situation that we've been doing as an association for throughout the year, really does show the value of a public-private partnership. And your chamber and others have done an extraordinary job. And we've got a lot of work ahead of us as we reopen the economy and our businesses.
Well, thank you, Steve. Steve, what role do you see the chain drugstores playing in the future on the distribution of the vaccine once it becomes available?
Yeah, let me tell you a little bit about our association. The National Association of Chain Drugstores represents traditional drugstores, both large chains with up to 10,000 stores and smaller regional chains of 4 stores. So our membership includes anything but 4 stores or more, just not traditional drugstores. So we represent all the food and grocery chains down in Texas. I don't know if you've got an HEB down in your area down there, but other regional chains would be members of ours. And then the mass merchants, Walmart, the Targets, the Costcos, of the world. So we're playing a very important role. We've been involved in COVID since most people knew about it. We've been involved since February when the president was in the Rose Garden in March and declared it a national emergency. We had CEOs of our member companies there, CVS, Walgreens, Walmart was there, and Target, and they committed to do testing in their local communities, which our members have been doing. But at the same time, we're going to play a very instrumental role in the vaccines once they become available. We got some preliminary good news yesterday out of Pfizer, as you all saw. So your meeting today is extraordinarily timely. But we're going to play a huge role. And we have within our membership, we have 40,000 stores in all three of those categories that I mentioned, and 90% of the American people live within 5 miles of one of our member company stores. So we are the most accessible healthcare professionals in the country. We employ 3 million people and 155,000 pharmacists throughout the country. And in many smaller communities, we're the only healthcare provider in the local area. So we will play a really big role on COVID vaccines once they're available, and really the flu vaccine, which is available now, which we're encouraging every person to get their flu shot.
Steve, just as a follow-up to that, one of our media partners indicates to us that they've noticed that Texas has the lowest participation rate in the nation for obtaining flu shots. Is there evidence out there that Texans will participate in a COVID vaccine once it's available?
Yeah, we have polling data on all states. I don't have the Texas numbers right here handy with me, but it's going back to the flu shot. It's really important that the American people get their flu shot. Our polling has shown that 90% of Americans realize that wearing masks and social distancing and other protocols that are issued by CDCs are really important in order to protect themselves and their loved ones that they come into contact with. But we're only seeing at the national level that 67% of Americans get their flu shot. And it's very important that they get their flu shot this year. In the last flu season, we had approximately 65,000 people that died. We had 500,000 hospitalizations. And if we hold up with those numbers this flu season, it will exhaust our healthcare system, which is highly fatigued. And the idea of having a twin-demic between flu and COVID is really not going to be good for our country. And we're seeing, as you know, spikes in COVID right now. So it's very important that people get their flu shot and the COVID vaccine once that becomes available.
Steve, what's your data saying about the reluctance of people to get a flu shot?
I think a lot of people have different reasons, according to our data. Some people think that you can actually get the flu from the flu shot, which there's no evidence to do that. There's very limited side effects that you have. There are some people, as you know, there's quite a movement of people that don't want any types of vaccines. And that is one of the factors as well. But we've launched a very aggressive public relations campaign. You may have seen some of our ads. We're partnering with the local chambers. We're partnering with state legislators, both Republicans and Democrats throughout the country. We're working with the National Association of Medicaid Directors. We're working with the U.S. Chamber. We're working with the American Society of Association Executives, and probably only Wayne knows that even association executives have our own association. But we're partnering with everybody to encourage people to get the flu shot, because if we have this twin-demic of both COVID and the flu, it's going to hurt opening our communities. It's really kind of interesting. In the polling data, we look at various categories, and there are so-called persuadables out there, and they have a tendency to be younger, with probably lower education, and but their number one issue is the economy. as we discovered in the recent election that took place and the polling data that was done in various exit polls. And we cannot get to really opening our economy unless we, stop the flu and stop COVID. So we're encouraging people to get the vaccines. And I think that's why sessions like this is really important to get word out in the local community. And I did an interview with, we did a satellite media tour, and we hit 210, all 210 TV markets in the country. A lot of times just focusing on the local news. The TV news, and that partnership with, and they would personalize then the importance of getting a flu shot and then later a COVID shot with their local community. And I think that's a great opportunity for chambers, drugstores. I think you have some state legislators on your program following me to get the word out about the importance of this.
Steve, do you get a sense that the pandemic is going to change the role of drugstores in the United States?
Well, first of all, I want to compliment the people that we have working in our stores for what they've done on COVID, both in terms of testing and vaccines. And you come out of pharmacy school now with a doctorate. You have a doctor of pharmacy, so you are very well educated and trained in expanded services beyond the important service of dispensing medications, which keeps everybody healthy. But I think it's changed quite a bit. This is COVID pandemic has been called the great accelerator in a lot of aspects of our society. Things we thought that might happen 5 years from now, both in terms of technology and healthcare and other aspects of our society and economy. Instead of happening in 5 years, they're happening this year. And I think that we've always focused on our member company stores being a center of health and wellness. And I think we're going to be really well suited moving forward. Our stores, our members got a lot of credit when the Medicare Part D law was passed. Back in the administration of George W. Bush, in terms of helping people knowing what types of medications were going to be covered and getting them on the right health plan so they could save money in their prescription drug costs. And I think we're going to be seeing when we get on the other side of this pandemic, that I think that that this will have been shown to be a real inflection point of the role that pharmacies can play in the health of our country and its people for many, many years, if not decades to come.
Is your industry receiving are your members getting the resources necessary to combat the pandemic?
Yeah, we are, but it's been mixed, to be quite frank. The U.S. Secretary of Health and Human Services, Alex Azar, and his team have been really terrific in making sure that our member companies, employees, and stores are being fully utilized. There's a law called the Public Readiness and Emergency Preparedness Act, which has an acronym, as you might guess, being in Washington, called the PrEP Act. And we've had 4 declarations to date in terms of allowing pharmacists to do COVID testing, to administer the vaccines, to allow technicians, pharmacy techs, and interns to have expanded authority as it relates to the vaccine. And then also we have grave concerns about people, particularly children, not receiving their immunizations as they regularly do. They stayed away from getting them at the start of the pandemic, but we need to have some of those makeup vaccines taken, and that was another declaration we had under the PrEP Act. The biggest issue we have, Wayne, is what happens in the states. We have rather these outdated, archaic scope of practice laws that we're working on, and most states have really done a fairly good job because they realize if we are going to attack this insidious virus, we are going to need the services very well-trained and educated people like pharmacists, in addition to others in the healthcare community. So we're attempting to reduce those barriers by working with the governors in all 50 states.
And what is the greatest challenge facing your industry today, Steve?
A lot of these barriers are really important. I think that we're seeing, just to have more effective and efficient policies. You know, I'm a firm believer of markets, as you might guess, since I'm involved with the Chamber of Commerce and have for a very long time. But our healthcare system has changed so dramatically over just the last 5 years, and it really has changed in this area. And, you know, this telehealth issue, or virtual health, I guess it's now being called, all these areas are redefining how we're delivering healthcare in our country. And we've done a pretty good job as an industry, or as an association, and our members have done an extraordinary job of providing really great advice and guidance through this. The Gallup survey does a survey of the most trusted professions in the country, and they do this survey every year. And pharmacists are right there in the top 3 with physicians and nurses. And it's interesting that all the top ranked professions are all healthcare related.
Interesting. How would you evaluate the changing political environment? How is it going to impact your role in drug distribution?
Well, I've had a interesting role in the last year. I've been asked to join a panel of about 35 people that's advising Department of Health and Human Services, the Department of Defense, National Institute of Health, Centers for Disease Control and Prevention, FDA, and the governors in all the 50 states on how we're going to be rolling this out. And I wish the American people could see what I see in terms of the amount of work that has been done. Getting 330 million Americans immunized is extraordinarily complicated, as you might guess. The various vaccines that will be coming out will all have different requirements. As an example, the Pfizer vaccine will have to be held at very cold temperatures, under 100 degrees Fahrenheit. And it's very, very complicated. So, you know, I'm very confident that we have the professionals in these agencies that we're not going to miss a beat. Just because we're changing the administration, if that in fact happens, even though it seems to be in dispute by some, that if we get a change, we're not going to see much of a difference in terms of how this is being rolled out. So I'm very encouraged about that. And I tell you what, I've been on the phone with, you know, 3 4-star generals who are working on the logistics of this, and nobody does logistics better than the American military. And that's just one example. I mean, we've got really some dedicated people at all those agencies I mentioned that are working extraordinarily hard because they know how important this is.
And following up on that, I saw that report this morning on Good Morning America about the necessity to keep the vaccine that Pfizer has developed at an extraordinarily low temperature. Do stores have that capability today to keep something at 100 degrees below zero?
Not all stores are going to be, not all vaccines are going to be at that level. There'll be various ways in which they'll do it. It'll be relatively stable at temperatures that our member companies can do, because various other vaccines have to be held in a refrigerated or frozen condition, basically, before it comes out, or before in freezing temperatures. But yeah, we'll be ready to go. Our members are ready, and there's been so much work that's been done behind the scenes by others as part of the distribution system, from the pharmaceutical wholesalers to the retailers, and to what the manufacturers are trying to do to get this on the market right now. I think people have to be slightly cautious with this good news because there's a lot of work that, still needs to be done. It'll be several weeks at the earliest because researchers and regulators are still going to need to make sure that the shot is safe. The FDA wants to see 2 months worth of safety outcomes after the vaccination for half of the people that are participating in a large final stage trial before authorizing it to happen. And at the same time, the shots for Pfizer and BioNTech, which is the partner with Pfizer on this, could start becoming available for some by the end of the year because production has already begun. But really, the supplies will be very limited. Pfizer, as I understand it, says that it expects to produce up to 50 million doses globally in 2020, and that's enough for 25 million people because this particular vaccine will require 2 doses, and they may have up to 1.3 billion doses in 2021, as I understand it. So this means there'll be a limited amount of vaccines out there, and those in the highest risk groups, such as first-line responders, those in nursing homes, would be inoculated before others. But what this means for all of us, and Wayne, you and I are kind of in the same business. We hold meetings, and we like to get people together at our gatherings, and those large meetings were canceled this year. And as we roll this out over the coming months and into next year, reopening the economy is going to take probably a little longer than people thought. We're still going to be wearing masks. We're still going to be required to do social distancing because this is a global pandemic, as you know. And, we have to get this under control, both in the United States and worldwide, before we fully open.
And Steve, one last question. There are generally a couple of groups. One that wants to take the COVID vaccine immediately, and another says, "I think I'll wait and see how it plays out." What should the general public and chambers consider when making the decision about getting down to their pharmacy once the vaccine becomes available?
Well, I think by the time the vaccine becomes available, the government would have analyzed not only the efficacy of it, but really the safety of it. And I think that they ought to be consulting their pharmacists and their physicians and those that they respect. But we really don't know what vaccines are going to be out there quite yet. And they all will have different qualifications and standards that they're going to have to meet. But FDA has really been very stringent over the years in making sure vaccines are safe when they are coming out. And most of these will be coming out under an emergency authorization, which will speed up the timeline. So I think the American people should have confidence in the ability that these vaccines will protect them safely and effectively by the time it goes through all these various areas of jurisdiction for approval.
That's great. Well, any questions for Mr. Anderson from the audience? If so, unmute your microphone, please, and ask him.
Yes, I have a question, sir. Some of the vaccines are developed from fetal tissue lines. Will the public be able to have ready access to that information?
That I don't know.
Okay. Will there be options at your pharmacies to be able to choose a vaccine?
Well, we don't know what vaccines are going to be approved yet. So yeah, that okay. I think one of the unknown. I haven't heard that discussed in the meetings that I've been in, so I really don't have any information on that. Sorry.
Okay. Well, thank you so much for the information that you have. It's wonderful. Thank you, sir.
Sure.
Any other questions for Mr. Anderson? Well, Steve, I'll give you a chance to have closing remarks before I thank you officially. Any final thoughts for our group?
No, I just want to go back to my earlier remarks. I just want to thank you all for everything that you're doing, and for, information is very important, and I think having sessions like this, Wayne, is, it's a great service to your members and to the broader community, and it does show the importance of working together. There's so much we can do by working through associations and other organizations and chambers that we can't do by ourselves. And this is a time of, this is the greatest crisis that we've had from a public health perspective in 100 years. But I'm an optimist, and I'm sure we're going to be having our meetings very soon, probably sometime at the end of next year. So thanks for everything you all do.
Well, Steve, we want to thank you. I think my members just realized why you were named the top trade association executive in the United States just by your appearance on this call. Yeah, that industry is very fortunate to have you as their representative, and I'm fortunate to have you as a friend. It's great to reconnect with you again, and thanks for everything you're doing for the American business community. We really appreciate it. And hope you'll call on us if there's any role the Nacogdoches County Chamber can play in helping you folks accomplish your goals. We're there for you. So
great. Thanks, Wayne. Great to see you again.
Good, Steve. And you're welcome. You and Chris are welcome to stay on the call. We're going to move into our next presenter, and it's the president of the Stephen F. Austin State University. Would you welcome Dr. Scott Gordon? Good morning, President Gordon.
Good morning, everybody. Quick update today. COVID is still in check on campus, and I am extremely confident that we're going to make it through the fall term. Currently, we have 6 cases, and only 3 of the 200 isolation spaces are currently being used. We are going to be having a fall commencement exercise here on campus, and they will be in person, and we have a lot of safety changes that will be occurring, and we have limited family seating. All folks will again be required to social distance and have face coverings, but and then tickets for entry into the Coliseum, and but we're expecting some good turnout for that, and the kids, the students are extremely pleased and excited. And we also have a number of our last spring and our August graduates that will be walking through those ceremonies. As most of you know, our classes will be mostly remote after Thanksgiving, and our plan right now is to start spring classes on January 8th. And again, we'll have a mix of online, face-to-face, and hybrid setups or modalities for those courses. Spring registration is started now, so if you're interested in taking spring classes, go ahead and begin thinking about what classes, and registration is open. And that's my report for today.
Well, thank you, Dr. Gordon. Any questions of Dr. Gordon? Well, thank you, sir. And that's encouraging news about the COVID trends. And thanks for you and the staff for the management of this whole pandemic over there. Would you welcome this morning Dr. Amy Mahaffey for a Nacogdoches COVID-19 update? Good morning, Dr. Mahaffey.
Hello, thank you so much for letting me go a little early today. I've got an 11 o'clock and I didn't want to run up against that. And today my report is short and sweet. We had 3 new cases reported yesterday from the state, and today is Tuesday. So you'll, if you got our email on our distribution list, you're free to add yourself to that in the chat box. I'll add you to that, but we send that out every Tuesday on email and social media with our 7, 14, and 21-day moving averages. Our numbers are looking really good, and we hope to continue on that trajectory. And then those of you, we got a few questions yesterday about the way that we update our cases. And so I just want to remind everybody that we do have a interactive dashboard that we send out as well. And so if you want to look at the charts and kind of zoom in on certain days and things like that, that's also available to you as well. And I don't have a whole lot other than to keep up the good work to the community for keeping our cases low.
And that is great news compared to our friends in El Paso. We certainly need to keep that community in our prayers. I watched the national report on that this morning, Amy, and it was devastating to see the tents and the resources they're having to bring into town. And it is, I think, a good indicator that hopefully we're going to continue to decline in the number of new cases. So thanks for everybody what they're doing in this town. For the purpose of an economic development update, would you welcome the President and CEO of the Nacogdoches Economic Development Association, Larissa Philpott. Good morning, Larissa.
Good morning, Wayne. I hope everybody's doing well today. Just a quick update about NACDS. That's the small business grants that the City Council funded. We did round 1 last week, and the City Council approved round 1 last week. That was, I think, about 10 businesses. Donna did a great story on KTRE about it, showing how thankful those businesses were. So a big thank you to the City Council for funding that. We hope to have, or we will have round 2 to the City Council on December 1st. We are pouring through those applications. We've got to make sure that we are good. We're doing a good job in reviewing those applications and that we're good stewards of the taxpayer dollars that are being used there. But I just want to make one note to all of our businesses that are out there. We are struggling with the accounting documentation for these businesses. And in 2020 and 2021, we're seeing a lot of grant funds flow to small businesses. Please, please, please do your best to work with an accountant. The chamber also on a regular basis does QuickBooks training. You don't even necessarily have to pay an accountant if you're using QuickBooks. That's great. But in order to be eligible for a lot of these grants, and specifically for a lot of government funding, you've got to be able to show good accounting practices. And I see Charlotte smiling over there at the bank. My banking friends are appreciative of that message, and they struggle the same thing with small business loans. So if I have one message to send for 2020 and 2021, it's to keep up your books. And we look forward to getting this round 2 out to the businesses. Thank you, Wayne.
Thank you, Larissa. We're pleased to have the city manager of Nacogdoches join us this morning, Mario Canizares. Good morning, city manager.
Hey, good morning, Wayne. Good morning, everyone. Hope everyone's doing well this wet Tuesday. Just a couple of quick things to report. Our hybrid meeting that we had last Tuesday with City Council, we had 3 members present. 2 were virtual. Actually went pretty well. There are a couple of little small things we'll need to tweak with the sound of the microphone, but otherwise it went pretty well. And actually had folks attend the council meeting and speak to council in person, which was the first time that's happened since probably mid-March. So that's good to kind of get back into sort of a normal environment. The second thing is more on the public safety side. Last Thursday, we had a really good event over at the county courthouse. We had 5 police officers get sworn into the Nacogdoches Police Department. That's a huge thing, and we've had a number of vacancies in patrol, and to be able to add 5 in one fell swoop was really a big shot in the arm for the police department. We've got 4 additional folks that are going to the police academy, so hopefully within the next few months, we'll have a full slate, almost fully staffed police department that we have not had for quite some time. So that'll be a big for our folks that are on patrol, be able to go back to their regular shifts that they were working on before, and they've had to unfortunately change things around just to be able to keep our streets patrolled in our community. So. Otherwise, things are going really well here in our city, and if I can answer any questions, I'd be happy to.
Any questions for our city manager? Well, just one observation. I hope one of those new officers is assigned to monitor the speed of Gary Lee Ashcraft.
Absolutely.
Who's on this call? I see him go down California here, and he's always exceeding the posted speed limit. So.
Thank you,
Mario. I appreciate that. I'm sure that Gary didn't appreciate that at all. So, but I do appreciate that report. Thank you, sir. Pleased to have with us Betty Rousseau, representing the Office of Governor Greg Abbott. Good morning, Betty.
Good morning, Wayne and everyone, and thank you again for having me on these weekly calls. That means a lot. Thank you. Just a few things today. Governor Abbott issued a statement after Site Selection magazine named Texas the top state for foreign direct investment projects and the top free trade zone state in the country. So Site Selection also included 2 Texas metropolitan areas on their list of top FDI project metros. The Houston, Woodlands, Sugarland was number 5, and Dallas, Fort Worth, Arlington was number 6. So that was a good announcement. And I mentioned this one last week, but I wanted to remind you, the Texas Department of Agriculture announced several competitive grant applications for their 2021 Texas Community Development Block Grant programs, including the Community Development Fund, Colonia Fund Construction Program, and Downtown Revitalization Program. Applications for all are due on May 3rd. So the next one, this is today. It's through the Texas Workforce Commission. It's the National Apprenticeship Week event. It's a webinar today, or a virtual town hall is what they're calling it. It's at 1:30. They are saying it's a celebration of National Apprenticeship Week and Texas Apprenticeship Week. Learn the benefits registered apprenticeship brings to veterans embarking on their civilian career path. You can listen in as employers discuss key strategies they have used to increase participation from veterans in the area. And that's it for me today. Thank you so much.
Thank you, Betty. Any questions of Betty? Again, thank you, Betty, for joining us. This information is so helpful to get that state perspective. Would you welcome, for the purpose of the hospitality industry update, my great colleague, Sherry Morgan from the Nacogdoches Convention and Visitors Bureau. Good morning, Sherry.
Good morning, Wayne. Good morning, friends. Our visitor counts continue to rise, mostly day traffic, and next week we'll receive our monthly Smith Travel Research Report to see how many of those converted possibly into some overnight stays. So look forward to that reporting. Our 9 flag trees are slowly going up in the Charles Bright Visitor Center, and we expect all of them to be up and ready for viewing the first week in December, and then enjoy for the rest of the holiday season. I want to thank again our generous sponsors for enriching the holiday landscape here in Nacogdoches. We also have the extension of our NAC at Night drive-in experience. That's going to start up again the Saturday following Thanksgiving and extend through December each Saturday. And as a reminder, the first drive-in that we did, where we showed Oh Brother Where Art Thou, was a free event, and it was done in conjunction with the grant-funded Big Read program and the library. But moving forward, the drive-in movies and concerts are going to be organized by the CVB with the support from the R.L. Mangum Airport crew. And there, as such, will be a cost involved. So it's a flat rate of $20 per vehicle. And those tickets will be made available online through Eventbrite, and then some will be held for in-person sales here at the Visitor Center as well, for those that are unable or just would care not to purchase them online. I get asked often to what I attribute our increased visitor traffic to, and I equate it to the overall tone of our community. Hopefully we all have that one friend in our life who is our safe spot to land when we're troubled, and we can share our thoughts and concerns with them and know that those thoughts are being received without judgment or animosity. We can go to these people in our lives as our vulnerable selves without fear of any additional harm and start to heal. In my opinion, Nacogdoches is filling that role for people. There is an undercurrent of kindness and compassion and grace here in Nacogdoches that people are hungry for, and we're honored to fill that need. Throughout this pandemic, we here at the Visitor Center have tried really hard to focus our sights on the cans instead of the can'ts. because there are a lot of things that are different now and that don't look likely to go back to what they were like pre-COVID. And so I have a little challenge for you as you navigate your way through your week, especially now in this post-election season. Check in on one another. We might disagree, but those opposing thoughts do not in any way negate the very real feelings that we and our neighbors are currently processing. Make "how are you doing" more than just a rhetorical question. Ask and then listen to the answer and be poised to act with intention of lightening their burden in whatever way that you can. And lastly, in human nature, it's just natural to point out the deficits, what things are lacking, instead of taking a pause to celebrate the really good things that we see. So look for positives and share to those engaged in or responsible for those positive contributions to our shared culture here in Nacogdoches. Isn't it odd that we all too often save our respect and gratitude for a person until their funeral? What would it look like if we outlined people's contributions to them while they were living instead of in their eulogy? And how might it change someone to be lifted up every day by 6 people and friends instead of when they're serving as a pallbearer? Let's commit this morning to showing up as our very best selves and extending grace. You friends matter, and you friends make a difference. And I thank each of you for everything that you do in your individual roles here in Nacogdoches, for making Nacogdoches a safe space for our residents and our visitors alike.
Thank you, Sherry, for those very inspirational words and a great reminder to all of us. I appreciate that very much. Any questions with Sherry? Moving on, we'll hopefully hear from Representative Travis Clardy, recently reelected, if he's on the line, or Senator Nichols. I don't think Nancy Wyndham has joined us, has she? I do see that Gary Lee Ashcraft is on the phone. Gary Lee, you want to give us an update for the United Way, please?
Sure. I guess you haven't seen me on North Street, Wayne, but appreciate the call out. There goes my wife. The United Way is very active. I'm focused on the campaign. We've extended the campaign, the annual Live United fundraising campaign, to November 23rd, and it's due to the COVID going forward. So you still have an opportunity, if you haven't, to donate to the United Way, and I certainly hope you do, or to manage a workplace campaign in your place of business. Coming up is the Turkey Trot. It's going to be full bore. It'll be on Thanksgiving morning. I think the registrants are coming on in. It'll be socially distanced and done appropriately as best we can, and is a good way for you to burn off the calories if you think you're going to get them that day, and I do think I will. And so come on out and run or walk, either way. That starts, it opens up at 7:30, I think, and the race starts about 8:30. We have also a kids race. I think that one starts at 8. And we have kids that come in there and they get medals and all sorts of things. So it's a lot of fun to watch. It's a real family affair. And people, Sherry Morgan, come from out of town to do that race. So that's kind of cool too. And then there's this thing called the Lighted Christmas Parade. I can finally talk about it. It is going to be held on December 5th at the Nacogdoches Dragon High School campus. And it will be a reverse parade. You will go to our website or our Facebook page to find out all the details, so I don't spend a lot of time on this call. And a reverse parade means that the wonderful, beautiful floats, holiday floats, will be parked on the side, on the roads. You'll be given specific directions of how to drive through that parade and view the floats and enjoy that festivity and that kickoff of the Christmas season. I will not be driving through there. So that's the end of my report. Thank you all for all the things you do, and live united.
And thank you, Gary Lee, to you and to Caroline for all the great things you really, all kidding aside, the great things you do to help so many different agencies in town. And we realize this is an unbelievable period that you folks are dealing with, and coming up with innovative approaches like the parade, I think are certainly commendable. Thanks for everything you guys are doing. I want to welcome this morning the Communications Director for the Nacogdoches Independent School District. Would you say hello to Les Lineberger? Good morning, Les.
Good morning, Wayne. Thank you very much. We're coming up a little more than a week from taking a break for the Thanksgiving week holiday. I know that our teachers, our students, and our parents have been working extremely hard since all of this got started back in the spring. And I know that they are looking forward to that break. And then we'll come back and get ready for the Christmas season. This Friday night, our Nacogdoches Dragons return to the football field here in the friendly confines. That game will be at 7:30 p.m. at Dragon Stadium against Jacksonville High School. Now I'm going to post a link to anyone that's interested in getting tickets. It'll direct you for anything that you'll have to do to obtain those tickets, and they're sold in a tiered fashion as we move through the week. But just so you know, we're still at the limiting the capacity of Dragon Stadium to roughly 50% right now. And that link right there will get you to where those tickets are being sold. But more than anything, Wayne, our teachers and our students have put out so much effort, both for in-person classes and in those classes being taught virtually. And I know they're really looking forward to that week coming up later this month where they can get a bit of a break from all that. But I thank you very much for the opportunity. Thank you, Wayne.
Thank you, Les. Are there any other announcements or any of our participants on the call? Well, I have a couple. First of all, I want to remind you folks that we're going to do a program tomorrow here at the Chamber with our partners from NEDCO, and that'll be a seminar that will start at 8:30 a.m. It's a virtual seminar. You can find it on both NEDCO's and the Chamber site, and it's titled The Right Employee Right Now, and it's going to be a great program at 8:30 to 10 a.m. tomorrow morning. Do want to let you folks know that starting on Thursday, I'm going to be taking an extended leave from the chamber. I've got a date in Houston for surgery on Friday, so I probably will be out of action for at least 3 weeks, it would appear right now. The good news is the chamber is in very capable hands. Kelly is going to be picking up the gauntlet, Kelly Augustine. So if you have any questions on programs or anything else, please feel free to let Kelly, give Kelly a call through the process. I thank all of you folks for your continued participation in these calls. I do want to thank once again Steve Anderson for joining us. I can't tell you how much pleased we are to have him take time out of his incredibly busy schedule to help inform us here in Nacogdoches about the state of drug distribution and the industry here in the United States. And I hope all of you folks have a successful and profitable week, and I'll look forward to talking to you hopefully in about 3 weeks once I get back into action. Thank you, folks.